Hello everybody, this is Richard Evanson. I am an orthopedic surgeon here at Plano Orthopedics. I want to talk to you today about 5 things that you need to ask your surgeon before undergoing surgery. The first question is, are they fellowship trained? Second, you need to ask them, how long have they been performing this procedure? Third question is, how many of these procedures have they performed? Fourth is, how many have they performed within the last year? And then lastly, I want you to ask, how specifically do they perform this procedure, and ask details. So now that we've listed those 5 questions that you should ask your surgeon, we're going to break those down individually into specifics. So first question is, are you fellowship trained in this procedure? It doesn't benefit you to have a fellowship trained surgeon who is perhaps fellowship trained in, for example, hand and elbow, to be performing your hip surgery. So it's important to understand that they should be fellowship trained in that particular procedure, in that particular body part. So if you're going to have a hip replacement, for example, find someone who is fellowship trained in hip arthroplasty or hip replacement. Second question is, how long have they been performing this procedure? So you need to understand that surgeons are practicing the art of medicine, and it takes time to get very good at your craft. So you may not want a surgeon that is perhaps directly out of training. You want to find someone who has been doing this procedure for some time and has perfected that art. The third question that you need to ask that surgeon is, how many of these surgeries do you do? That's a very important question, and the analogy I like to give here is that of someone like Steph Curry. Steph Curry is only as good as he is at shooting the 3-point because he practices every day. Your surgeon should be performing this procedure on a regular basis. And so you also need to ask them, not only how many of these have you performed, but how many of these have you performed within the last year? It's an important question to ask them, because it doesn't matter if that surgeon has performed several hundred of these procedures if the last one they performed was 6 months ago. Okay, this is something that they need to be up to date on and performing on a regular basis. Now, the fifth and final question that you need to ask your surgeon before undergoing surgery is, how exactly will you perform this surgery? So an example that I'll give you is that with total hip replacement. There's different ways to perform a total hip replacement. You can do the traditional posterior or lateral approach, or an anterior approach, meaning through the front. Differences here, for example, would include the traditional method of going a posterior approach, which requires you to cut through muscle and tendon, which has a longer recovery, more pain, and higher risk of dislocation, versus an anterior approach, which is not only a smaller incision and less invasive, but doesn't require you to cut through any muscle or tendon. These are very different. This is very important to understand the differences between these surgeries, because that can make a significant difference in your outcome, and you want to make sure that that surgeon is proficient in the best method. In my opinion, this is the anterior approach when it comes to hip replacements. So that is an important detail to understand. Not only do they know how to do the anterior approach, but how many have they done? How long have they been doing it? Were they fellowship trained? And this way you can kind of reassure yourself that you've received, or going to receive, the best possible surgical outcome for that surgery that you're about to undergo. Thanks for listening to this video. Again, I'm Dr. Richard Evanson, hip and knee specialist here at Plano Orthopedics. I hope that this video is very helpful to you. If you have any suggestions or recommendations, please leave them in the comments below. Otherwise, I hope that this is a very helpful video for you, and take care.